Welcome back to Houston Life. Our next guest is considered a global pioneer in cancer research and treatment. With a career that spans more than 5 decades, Dr. Philip Salem has become a living legend in oncology, transforming how we understand and treat this devastating disease. His latest innovation, called IC Triplex, may be the most promising step yet toward a cure. Dr. Salem joins us now, along with his patient, Hans Langers, to chat about what he is calling a groundbreaking treatment. Gentlemen, welcome to you both. Welcome to Houston Life. Hans, you are a stage 4 colon cancer patient. You are in remission. I cannot wait to hear your story. Dr. Salem, I want to start with you. IC Triplex. This is a combination of immunotherapy, chemotherapy, and targeted therapy, and people are traveling from all over the world to come see you. Why is this such a revolutionary approach?
It is a revolutionary approach because we use two philosophies which are new. The first, we have learned over the last 5 years that the cancer cells in an individual patient are not all the same. Some respond to chemo, some respond to immuno, some respond to targeted therapy. So combining all these treatments should eradicate and kill more cancer cells. The second thing we learned, which is revolutionary, and that's the basis of this treatment, is that contrary to the standard concept that like 100 patients with lung cancer should receive the same treatment, we have learned that there are no two patients who have the same disease. And therefore, treatment has to be tailored to the specific patient and to the specific cancer the patient has. In the past, we treated patients based on how the tumor looks like, the anatomical diagnosis. Now we know far more. It is more important to define the cancer at the molecular basis. And at the molecular basis, no two patients have the same disease. Like if you take 100 patients with lung cancer, at the molecular basis, no two of them will have the same disease. And therefore, though every patient will receive immuno, chemo, and target, but no two patients receive the same treatment.
And logically, I think a lot of us can understand that this makes total sense, that no two patients are alike.
Absolutely.
Their treatment must be a little bit different. What kind of success rates are you seeing with your patients?
You know, we started with the patients who were considered terminal, patients who came from high-ranking cancer centers in America, and they were told that the only option they have is to go to hospice care, that there's no more any additional treatment. They have exhausted all standard treatment. That's how we started to use the IC Triplex. And then we saw that the responses are very impressive. Then we started to apply it in all cancer diagnoses. And right now, we have like 80 patients that we treated of all kinds of cancer. The complete remission rate is 53%, and the partial response rate is 36%. So we have a total of a complete remission and a partial remission of approximately 90%. This figure, this rate does not exist in the medical literature except in ICT Triplex.
Okay, these are incredible success rates. Hans Langers, you are one of these patients who had a diagnosis that other doctors essentially told you there was no hope. Stage 4 colon cancer. This must have been a terrifying diagnosis.
Yes, it was being told in the beginning of December, and I went to 5 hospitals in Germany, Belgium, and Holland to get a second opinion because my hospital told me there's no possible treatment. You have a life expectation for 6 to 9 months.
Wow.
And we can give you only chemotherapy. And then I find out about Salem Oncology from a friend. I contacted, I spoke with 5, 6 people, and that's why I went to Houston.
So you traveled here from the Netherlands Hans and his wife Karen made this flight over to see Dr. Salem. Your success rate is incredible. I understand your numbers are going in the right direction. You're considered in remission now.
Yes. We, after 2 months, we had already the 80% remission. And now after the third, we just closed the third, and we started with the fourth last week. We have now 98% remission.
And many cancer patients report all kinds of side effects when they are going through treatments. What have you experienced?
That's the great thing, what they do. They have 5 fantastic nurses, and they give you so much support that in the 4 months I've been ill with a little bit diarrhea, nothing serious, but for 1.5 weeks. So they give you a lot of supports, and that's the reason why you feel good, you stay eating, so you keep your weight. And in Holland, I had a treatment, and after 3 weeks, they saw me back in the hospital. In the 3 weeks, I really wanted to give up because I was so ill. And this is the very important thing, what he explained, that the tailor-made treatment, how he gives the medicines.
It's incredible, Hans. Yeah. I would pass you on the street and have no idea you are a stage 4 cancer patient. Dr. Salem, essentially, the emergence of immunotherapy, you've had a long career in oncology.
Sure.
I mean, decades. How has this changed your view, and what does this mean? I mean, it seems like we should be doing this all over the world. Is it ready for widespread adoption?
Sure. Immunotherapy has changed radically the landscape of cancer treatment. I have been in cancer medicine for 57 years. I'm probably the oldest medical oncologist in this country. I've seen it from its birth till now, the treatment of cancer. And I can tell you that immunotherapy has changed the landscape of treatment. The problem is how to use immunotherapy, how to use chemo, how to use targeted therapy. There's a lot of art and science in that. And all the drugs that we use are FDA approved. The innovation is how we use them and how we combine them. And I feel at this point in time that patients who exhaust all standard and conventional therapy, the best option they have is, I see, triplex. These people are not only stage 4, they are the end of stage 4. They are very, very advanced. They are against the wall. There's no hope for them. We opened a window in that wall. So the patient, instead of looking at a wall, it looks at a window to see life again and not death.
Wow. Dr. Salem, you're an incredible resource, and I hope that doctors around the world use what you're doing as a blueprint to save people's lives like Hans. Hans, I'm so glad to know you are doing well, and best of luck to you and your wife. Check in with us when you can. And unfortunately, we're out of time. We got to leave the conversation there, but thanks so much to you both for stopping by Houston Life. It really is incredible and groundbreaking what is happening right here in our own backyard. Hans Langers, Dr. Philip Salem, thank you once again. And for more information, you can visit salemoncology.com. You can also pick up the phone and give them a call, 713-796-1221. And Houston Life will be right back.